Services is a CHAP accredited and Medicare certified home health care agency that is owned and operated solely by registered nurses, all with advanced skills and extensive experience in home health care. Call us at 888-422-3578. Our team of caring professionals include registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Visit our website at elitehomehealth.com. All employees are subject to detailed background and reference checks. Their team-oriented approach ensures an optimal outcome for all of our patients. For more information, call us at 888-422-3578.
Good evening, everyone, and welcome to the show. My name is Ketsia Levasser. I am the owner and managing director for Premier Concierge Care Management. I do want to start by thanking Elite Home Health Services for sponsoring the show tonight. I am here to talk about my care management company, which is Premier Concierge Care Management. This is actually my third time on the show. I have been on the show before where I've talked about our services and how we are assisting in the community. But tonight, I wanted to take the opportunity to also give you guys a little bit more information about the agency. I am the founder and owner of the agency, and my background is basically in care management, long-term care, and also inpatient rehab hospital. I actually started Premier Concierge Care Management because I saw the growing need for services in the community for patients who are in and out of the hospital. I think that this is one of the most important topics that we've talked about every single time we are on the show. We talk about how patients are in and out of the hospital and some of the things that we can do to assist with that. And most importantly today, I think that it's important for me to also talk to you guys a little bit more about care management services, because many people don't know what care management is, and it's good to educate the community about the utility of those services and, again, what we can do for patients to assist them in improving quality of life. So care management is not necessarily a new concept, but many people don't know about it. It is actually an extension of case management. We all know that if you are in the hospital before you discharge home, you do have a case manager. That case manager is in charge of making sure that all of your discharge plans are carried out, meaning that whatever services that you need at home, they are starting those services for you. But particularly with the elderly population, we all know that we try our best to give them discharge instructions, to tell them what to do when they go home, who to follow up with, medication and all that. Yes, we do the best that we can in providing that information. Unfortunately, we see them coming back either to the emergency room or, again, being admitted to the hospital. We found that there has been some type of disconnect as far as from the information we provided to the patient, what has happened in between the time that they go home and now to a second time of them returning to the hospital. We are seeing that it's not as easy to carry out those discharge instructions as we case managers in the hospital think, because we are in the field, we know exactly what to do. Some of us are able to do it in our sleep. We tend to focus on the fact that we know exactly what we are telling our patients, and we are assuming that they know what it means. Now, they don't follow the patient when they go back to the community until they return back to the hospital. This is where Premier Concierge Care Management come in. What we do is that we work with patients and families from the time that the patient is admitted to the hospital. We make sure that we advocate for them. We make sure that they are getting the best level of care. We go into those hospitals. We communicate with the physicians. We bring in patients' medication list from home. We make sure that we understand which medications that the patients are being discharged home with, because we all know that the first time you go to the hospital, something happens. They give you medications, and every time you go in, they give you other medications. So a care manager from my agency basically goes in and advocates for the patient. We are surrogate family members where we are able to advocate for our patients. And the fact that we do have the expertise in care management, it makes it even easier for us. We are able to communicate with the case managers from the hospital, making sure they are setting up the appropriate services or at least initiating them. Once a patient is discharged, we do go to the home, we complete our own evaluation, and we also make sure that those supportive services are set in place. We know that the case manager, most of the time, they would make recommendations for medical equipment that the patient needs to have. They order through a vendor, but our care managers follow up with those vendors to make sure that the appropriate medical equipment is being delivered to the home. We make sure that we get all the medications at home for the patient before they even arrive to the home. We also do a home environment assessment. We make sure based on how the patient was doing before they went to the hospital to now, has there been a level of care? Has there been a change in the way that they were functioning before? Do we need to make sure that the home is safer? Do we need to give recommendations for things such as a grab bar in the shower that maybe previously they didn't have a need for? So we go into the home and we make sure that the home is safe for the patient to make sure that they can continue to feel better. My agency is not a home care agency. We do not provide private caregivers, but we do work with many companies in the community that have very good reputation, that have been able to provide us with very good caregivers that are able to meet our patient needs. So I think that one of the shows that we had previously, I did mention that one of the things that we do, in addition to having the family meet with the caregivers, we also sit in those meetings just to make sure that we are helping the family and asking the appropriate questions. And the fact that we already know our patients, we also let the caregivers know what we are looking for, making sure that it's a good match, making sure that that caregiver is going to be able to provide those services that the patient is needing when they are out of the hospital. That's one of the good things that we do. And again, in working with Elite Home Health, we are able to also make sure that the patients do have their home health services, which of course Medicare would cover for them to have physical therapy, occupational therapy. If they do need speech therapy for any cognitive deficits, we also make sure that we are able to provide those orders. And one of the other things that I really love about using Elite Home Health is the transitional care management and the transitional care program that they have. And I know that they've had this for a few months now. And one of the things that we see today is that now most physician offices do find themselves needing to use this particular service because of the coronavirus or COVID-19 that's going on. Many of those offices are not open. So Elite Home Health has already taken the lead on that, where they have been providing a home physician to the patients, and they also have been providing the patients with the ability to call their doctor, to FaceTime their doctor, to use any smart devices to be able to communicate with their physicians when they are not able to leave the home and go out and see their doctors. And I know that many people have a lot of questions about COVID-19, and I thought that it was very important for me to also touch on that and to make sure that I reassure all the families that we are continuing to work with them. We some of the things that Premier Concierge Care Management is also doing for our patients is basically getting in contact with patients' primary care physician offices, because we know due to the COVID-19 that's been going around and those offices are closed, many of those patients, especially the elderly patients, they are not sure how those offices are operating. Are you open? Are you closed? If I have a question, if I need something. So what we have done for each of our patients, we have called those offices, find out what are the measures and the precautions that they are taking, finding out their hours, their operating hours, whether or not they are open to seeing patients, or if they are seeing patients, via phone, or if they are doing what we call telehealth, which is a good thing that Medicare is actually paying for that. They are reimbursing physicians who are actually able to get on the phone, FaceTime their patients, and making sure they continue to provide care, even though we are going through these difficult times. So we do call those physicians' offices, finding out what they are doing to assist patients and whether or not, what their office hours are. In the event that we have patients that do not have a smartphone, they cannot do FaceTime, one of our care managers will go out to the home and assist that patient, because when offices were operating under normal business hours, we would also accompany our patients to the appointment. Therefore, we do set up their appointments, whether or not they are calling in or FaceTiming. We do set up their appointments to make sure that we are able to communicate with the physicians and giving them an update and making sure that they are being seen. And we have found that most offices are offering those services. It's just a matter of communicating with the physician office and making sure that everybody's on the same page. Because many patients are not aware that because the offices are closed, that's it, they just have to wait until it reopens. So these are some of the guidance that we have been able to provide to our patients, which we find that has been very helpful during these times, because again, we know that many of them, they have a lot of chronic conditions. They need to get that come in check every couple of weeks. If they have any other chronic conditions that they do need to see their physicians for on a regular basis, at least once a month, we know that we are able to make sure that we communicate those needs to the physicians' offices, and making sure that our patients are continuing to have a quality of life, because we understand that these times are very difficult. Everybody's scared. Everybody's fearful about what's going to happen. And one of the things that I think we've talked about before in the previous shows is the caregivers that are out of state, either in New York, Boston, up north. Right now, we know that they are not able to come down to Florida. So we have done a pretty good job at putting those family members at ease by making sure that they are updated to the minute as far as what's going on with the patients. We do reach out to every single family that's involved in the care of the patient to make sure that everybody is aware that we are here for them, and we are going to continue to provide the care and the services that our patients need. At this time, I think that we are going to take a break, and we'll be back after these words. Thank you.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects, provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
So when we left off, we were talking about the most important thing. How's it going to be paid for? Sounds great. It sounds like an awesome service. But how are individuals going to, let's start with you, Ketsia, how are they going to afford Premier Concierge and their help?
My services are out of pocket only for now. Certain long-term care policies, they do have probably a limited number, maybe 4 to 6 hours. Mm-hmm. But keep in mind that care management services do not have to be 20 hours a week. Mm-hmm. Because what we do is at the beginning, when patients are in crisis, the families are in crisis, we step in. That's when we see the most amount of numbers being utilized, because we are trying to stabilize that family. So once we are past the crisis, we make sure that we are talking probably 5 hours a week. because we do a weekly visit to make sure that everything is in place, make sure that we reassess the patient, we reassess the home environment, making sure that they continue to thrive at home. And then we call them, and if they have anything that happens, then they know where to reach us. We are open 24/7 for emergencies, so they can always get in contact with us.
That's great. So then, what type of long-term care policies kind of use your services or allow for your services, I should ask?
It really depends on the policy that the person purchases, because each policy is covered differently. We have policies that probably would give a patient a certain dollar amount, and there are others. And of course, the more money you put into your policy from the beginning, the more you get from it.
Right.
But because now care is getting so expensive, if you had a policy, let's say that paid you maybe $300 a day, like 10 years ago, you could get 24-hour care. But now with $300, how much care can you get at home for that?
Right.
So it's really hard to say that this is exactly what it covers. It's basically based on that particular policy and also when you need to use it.
Yeah. All the stipulations. Is
Right.
there any particular carrier that you would recommend, or just kind of just so general?
I mean, generally, it depends on whichever one is cheaper for you. But at this stage, we see that many of the clients that I assist, they've already had it. And many of them, purchasing a policy now is not even an option anymore.
Because they can't afford it. They're too
Not
old.
only that, because they know that most likely this person is going to start using the policy to begin with. So it's going to be very difficult for them to purchase at this point. It
Yeah.
is something that is recommended for people that are younger, 40, 50s, to get ready for the future.
Plan to be old.
Exactly.
And what about you? You guys use you're Medicare
We're
certified.
Medicare certified, so we're covered at 100%. So there is no out of cost for a patient to get home
So
health.
long-term care won't cover, if they did have a policy, won't cover any of your services, or
Right. Ours is the Medicare side of it. So
Mm-hmm.
as long as a patient has a straight Medicare policy, that is covered at 100% to all our services, including the nursing, the therapy. If a patient needs a home health aide for a short period of time at the beginning of when they come out of a hospital
Mm-hmm.
visit, we're there. And that is all covered under home health.
that's great.
Yep.
What do you think determines whether a patient can stay at home and get some home care versus putting them in assisted living? What are those signs that you have to look for?
The first thing to look at is the patient's cognition. You know, it's okay to not remember certain things here and there, but when it becomes a pattern, then it's a trigger for us to complete, let's say, a geriatric assessment just to see exactly where that patient is. And once we complete that assessment and we realize that there's no way this person can continue to be at home alone at night, and we can weigh the pros and cons with the family to see which would benefit the patient the most, having a 24-hour caregiver at home or having them go to an assisted living facility. So depending
Could
on...
also be cost-driven as well, right?
Exactly. So depending on, because again, as we mentioned, people are getting older, they are declining, and the average life expectancy right now is 78.93 years. So people are living to be well in their 80s, and sometimes they live even longer. So really what we do as care managers is really assist that family to make the best decision at the most appropriate time, because we don't want to keep pushing for 24-hour care and then in 5 years there's no money. So sometimes these are conversations that we have with them. We help them determine future cost of care, and of course the family makes that determination as to which one would be more appropriate for them based, of course, on financial.
And how does that, let's say, affect the patient? Let's say their cognitive's good, but they still can't be on their own. I mean, do you have to drag them kicking and screaming to assisted living? How does that work? What if they don't want to go?
They most of the time they don't want to go because we're
yeah.
talking about somebody who's been living in the same home for 50 years.
Right.
So many times, as I mentioned earlier, we take a proactive approach. We start having that conversation. We make sure that the family's having the conversation, because there's no way We can say today you go into an assisted living facility tomorrow.
Or do you tell them you're taking them for ice cream and then you take them somewhere else?
Exactly.
It's not going to go
What
well.
happens?
Not going to
That's
go well.
not going to happen. So it is a conversation as we start seeing little signs of cognitive deficits that we start having with the family. We start talking to the patient about it, because at least if they are prepared and we give them the option to decide what they want in an assisted living facility, because that's very important, because when somebody's packing their whole life
Yeah.
from a home to a one bedroom in an assisted living facility, we have to understand that it's going to be very difficult. Many times they feel that they are losing their independence.
Yes.
So making them a part of the decision making and making sure that we take them to the different facilities so that they can also see and be able to make that decision as to where they go, we see that it helps the process.
So they ultimately, as long as they're in charge of their legal still, they have the decision to say yes or no. They have the
Right.
ability.
Yes,
Yeah.
they do. And of course, you don't want it to seem like I'm your daughter and now I'm telling you we must go here.
Or I'm your
Like,
daughter.
it's-
Or I'm your daughter-in-law. and you're going.
that is
And
not
some
good.
of these assisted living facilities are absolutely stunning. There are
Yes.
so many
Oh,
of them.
yeah.
I mean, they're like 5-star resorts. It's
Resorts.
almost like
I
you're
would
at,
live there.
We go to so many of them, and they're like beaches. It's like going to a
Wow.
resort where you have
Yes.
all these wonderful activities.
Buffet
and-
breakfast.
Yeah,
Yes.
you know, it's just nice, and you get to see people that maybe you wouldn't normally socialize in your home
Right.
environment.
Yeah.
So I know that I've been working with a lot of assisted living facilities in Broward, and I can tell you one after the next. It's just more more appeasing for the
Yeah.
patient to go in, because there's always something to do, and they have movie theaters now. They have all kinds of things
have
that are
salons.
salons.
Salons?
Oh,
Really?
we have
Yes.
seen stunning assisted living facilities here in Broward.
Yes.
Yeah, we've brought some on the air, and I can tell you, I mean, the list of all the fun activities
We are in
and,
Boca.
and the list of fun things that they do are amazing.
Right.
So
Yeah,
Yeah.
what kind of activities do you see besides the movies? And
Oh,
of course, getting your
poker
hair done?
night.
we see all kinds of different things.
It's not
we
strip
see,
poker, is it?
No, we're hoping not. We're hoping not. All different kinds of activities. They do painting classes. They do ceramics. They do, I've seen some of the assisted living facilities doing like caring for plants and bonsais
that's
and
great.
teaching, and they do all kinds of, all the holidays and all the different activities and events and Mardi Gras night and poker night. We've actually walked into a couple, just we were visiting and we actually stayed and had a great time. So.
You know, you bring up a good point, because I think the number one killer of elderly is loneliness.
Isolation.
Agreed.
Yeah, isolation and loneliness.
Absolutely.
So having friends and activities and a reason to wake up in the morning,
Yeah.
Makes a
you know,
difference.
makes
And
a
they
big
also
difference.
have outings, like they get to pick and choose where they
Oh.
go maybe once a week. So it's
Shopping
not where you're
trips and-
just there.
Oh, they go shopping. They go shopping, huh?
Right.
That sounds nice.
So there are a lot of different activities, and trying to get an elderly person to agree to go to an assisted living facility, we have to show them all the benefits of being there, not just because we could be concerned 24/7. If they're not concerned, then
Yeah.
it's not their concern. So basically we need to show them what these facilities have to offer in order for them to be a little bit more receptive.
Yeah, I think yeah, you've got some variety. But when I was growing up, my great grandmother never wanted to go to the assisted living facility, and it was just such a dreaded place. And it was, well, she won't be with us long if we send her there, so let's try to keep her, home as long as we could.
Right.
But I think the model has changed.
Definitely.
The
And
model
it's geared more towards quality of life versus just this is the last place where you go.
so quality of life. When you're talking about activities, and what else? What else encompasses quality of life?
Quality of life, meaning that they're not in and out of the hospital because they have that medical oversight. They have that nurse that's going to check on them every couple of hours. And they have that nurse who's going to make sure that they are compliant with their medications. Many of them are able to see their own physicians on the site. And for those who actually see, if they have to go out to see a cardiologist who does not go to the assisted living facility, our care managers will make sure that we go with them to the appointments, making sure that we're giving a full report to the physician based on the last time they were there and anything that may have happened. So quality of life is not just the activities, but also keeping them healthy and compliant and keeping them in the community for as long as we can.
I used to hear a lot of problems about elderly patient going to one doctor for this, getting a medication, going to a doctor for this, getting a medication, and then problems.
Right.
What do you guys do that helps mitigate that problem?
Well, on our side, basically, our team of nurses and our clinical staff, they develop an individual care plan for each patient. So what we do is we go in and we assess what their medications, and making sure that we're in contact with, if it's a primary, if it's a cardiologist, we're going to find out what they're supposed to be on and actually stick to a plan. And then we develop that whole care plan for them. So with us, that's how we're able to help the patient, as well as the transitional care physician, who comes in and verifies if this is the right plan for them. So
I guess the pharmacy's also taking measures now too to make sure
do.
that the
they make sure
patients-
it's not interacting in the wrong way, or two medications aren't. And you would be amazed, it still happens all the time.
Right.
That, one physician may not speak to the other physician or the other specialist, and they don't know that they're both giving a medication in conjunction, or maybe it doesn't go together.
Right.
But they're catching it, and it's important to make sure that you have someone just double checking. Our nurses go out and they even help them fill their little their pill boxes in
Yeah.
their cases. So we're making sure that they're getting the right medication at the right time, as per the doctor's instructions.
Yeah. I see that Elite also offers psychiatric nursing. So
Yes.
what does that entail?
Mostly with our psychiatric nurses, we care for patients that may have different behavioral issues and may need monthly or weekly injections. So we have a psychiatric nurse.
What type of
multiple-
behavioral issues?
Well, it can be everything from schizophrenia to bipolar. We have multiple ranges of patients
So
with
now they're
different
elderly
conditions.
and they've, maybe they used to take their schizophrenic medicine on time and then now they're forgetting. Then
Right, and there's
Never really
patients
thought
with,
about that,
There's
but it makes
patients
sense,
with
yeah.
dementia, with Alzheimer's, with Parkinson's. There's all different kinds. We have patients with every different type of diagnosis and behavioral, different issues.
Yeah.
But we make sure that the psychiatric goes out, the psychiatric RN, and whatever medication. Like a lot of times when they're the injections, our psych nurses are actually administering that to make sure that they're not missing that dose and that they're safe and that they're able to stay home and be happy and not have any issues.
Yeah. So how often would they have to go out? Probably once a week?
Most of our patients, I would say, get more than a weekly visit. Absolutely.
Particularly if you've got a non-compliant
Yeah.
patient.
Right.
And that particular service is great because many times as people get older, everything is blamed on old age. So the person's prior medical history is not taken into consideration, because if you had some type of mental health concern before, just because you're older doesn't mean that it goes away.
Now you got a double whammy. You're old and you've got a mental condition.
Exactly. So we do want to make sure that we are appropriately screening those patients to make sure that we are providing those services that they need. Because again, if they're having a lot of behavior issues, then it becomes a problem where maybe this person cannot be at home anymore, when in reality, if we are able to manage that problem, then they can remain at home.
Have you ever had a patient so non-compliant with medication that you're like, okay, you just can't, is that when you made the determination you can't be at home anymore? We've got to put you in assisted living where you can get that 24-hour dose of medication or whatever you need?
Oh, there are definitely situations with patients who are non-compliant, but again, the patient has to be willing, either the patient or the family has to be willing to make that next step.
Right.
If they are non-compliant and non-willing, patient stays at home. You notify the proper channels and you let somebody know, but there are a lot of patients who choose not to do the right thing for themselves.
Yeah.
So,
Michaela, have you ever experienced clients who, they're elderly and they still want their independence, but you as the healthcare provider knows that you have to talk to that parent, that child or whoever is basically now in charge of them. Do you ever find that that's a problem?
Personally, I haven't yet experienced it, but I know it happens all the time. You do sometimes get a child or a parent or a significant other always trying to chime in and not really thinking. Sometimes they think they know best, and and I know that they come from a loving a loving place.
Yeah.
But that's our job as professionals, to let them know that this is what they need and this is how we can help. So yeah, sometimes we do come in conflict. But personally, I've had wonderful, wonderful patients and experiences. But I know Jackie, she's been in the business a lot longer than I have, so she could probably touch more base on that. Have you experienced that?
Oh, I've had a whole range,
Because I could see, I'm
Right.
old and I want to have my way, and I don't want you going around
Right.
my back and,
No.
Right.
I think the most important thing is that I've always tried to meet with the patient themselves. If their family member is with them, I always include them in the conversation, but I always make sure that I speak to the patient
you show
themselves.
that respect.
I do. And I found that if I go to them first and I let them know these are the services that I provide, this is what we're able to offer, it will normally come out a lot better. It's a lot smoother transition.
Yeah.
If I do not, if I try to, go jump to their significant other, their spouse, it's that trust isn't there. So we have to build that trust with the patient first and get
Yeah.
them to understand that we're here to just help them. And that's all we're here to do. We're here
Yeah.
to give them the best service.
You're not the enemy. You're not
I'm
going to take
not.
them away.
No.
You're there to keep them home longer.
And I'm a plethora of information, so I work with great companies like Hetzia's, where I can always have a resource. Like, families may not know that there's someone out there that does what she does. So by me being able to inform them on the front end, it really does help. They actually look at it as a benefit.
Right.
Yeah.
And many times all you can do is make a recommendation, because it's not an order that they must follow. But again, giving the recommendation means that you also have to explain the benefits of following that recommendation. Because again, people are not going to make decisions if they don't understand the value of what they are choosing to either purchase or what it is that they are agreeing to. So it's very important that we are able to explain those benefits and let them know why that recommendation is being made.
Yeah.
And most times, if we do take the time to provide that little bit of education and people understand exactly where we are coming from, we find that it's easier for them to actually comply.
Yeah. We're going to take a quick commercial break. Why don't you give your phone number one more time, guys? Start with you, Ketsia.
954-446-7022, Premier Concierge Care Management.
And for Elite Home Health, I'm going to give you the 800 number. It is 888-422-3578.
And we'll be back. Great job, guys.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects. Provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
And we are back. So this next question I'm going to ask you, I hope my dad's not listening. So when I'm interviewing providers, for let's say a certified nursing assistant or someone that you're going to use, what are some qualifications you should look for to make sure that you're getting mom or dad the right person?
I do not own. My company is care management only, but I do work with trusted companies in the community that are able to provide certified nursing assistants. They do go through their own background and verification process to make sure that these people are qualified to go into the home. Now, for myself, I do either sit with the family and interview those caregivers based on what I know my patients, what their preferences are.
So the family's in the room while you're interviewing who's going to be taking care of their parent or spouse.
Exactly. So we kind of like do like a panel interview where the family comes in, they ask questions, because sometimes we assume that what I would want for my mom is the same thing that you would want for your mom, but in reality it could be different. So we make sure that we get everybody in the same room and they can ask the appropriate questions. Then after, we could interview more than one caregivers, because we understand there is no one size fits all, because
Yeah.
this caregiver may be a great caregiver, but it's not a good fit for this particular
Doesn't fit
client.
the personality.
Exactly. So these are some of the things that we look at as far as, what the services that the caregiver will be providing are also, it's also important to take that into consideration, because we may have somebody who needs minimal assistance and we may have someone else who needs more than the minimum. So we also have to take all of that into consideration in making sure that we are placing the appropriate person that's going to be able to transfer the patient, to give the patient a shower, not necessarily carry them, but they do have the proper training and making sure that that patient is not going to be falling at home and they will be safe.
Yeah. So minimum care could be just kind of helping prepare the meals and
Correct.
just providing some company and making sure that their color looks good that day, and they,
Right.
like you said, taking their medication, they're staying hydrated. To maximum care is they actually need help actually
Bathing, toileting,
feeding themselves.
everything. Yes.
Yeah.
Hmm.
Did you have anything you wanted to add to that, Jackie?
Well, no, I guess with us, we do an extensive background check. We go in and we make sure that the patient has a minimal of certain years, usually 5 years in home health experience.
Yeah.
And we make sure that it is going to be someone to give the highest quality of care for our patients.
Yeah.
So that's definitely something that our agency would look for. And even with our nurses, our therapists, even our home health aides, everyone, we do want someone who really does show that amazing personality and that loving touch to be able
Yeah.
to help our patients, make them feel comfortable. Because no one wants that nurse to come in who's, being harsh or yelling. And sometimes our patients actually ask us, the family will ask us, well, you got to send mom a real tough one. And it's hard sometimes to figure out who that is, because ours are, they're in this business.
More nurturing.
More nurturing, because we're in a home environment. And I can tell you that I've had many calls from patients who've actually said that, the nurses are wonderful and they've become part of the family, and, they really get to know them. So.
And you bring up a good point, because I have to say, if God forbid I ever had to put one of my family members in a home, you want to make sure that you've got someone who's going to care and not leave them with getting bed sores and letting them sit there and watch TV and drool all over themselves. You want to get the right person.
Right. And for my agency, because we are essentially surrogate family members, we do everything that the family would be doing, but with our expertise in care management, we are able to provide that guidance. So we do oversee the caregivers that come in the home. We do make sure that they are actually having activities for that elderly person where they're not just sitting at home all day watching TV. Because my role is to make sure that the patient is getting the most out of the services that they are paying for.
Yeah.
So we do make sure that we supervise them, we monitor them, we make sure that they are able to provide the care and they are able to continue to provide care, even when there are instances, if there's a change in level of care, if the patient goes to the hospital, they come back home and they are functioning at a lower level, is that caregiver still able to provide the care that they were providing before? Or what would be the recommendations for care now that the patient is functioning at a lower level, making sure that we are able to get them back to optimal health. So these are some of the things that
Yeah.
my care management agency we do.
And if they become lower functioning, that may mean a change of staff or a change of type of individual that you have to use, right?
Correct. Yes.
How does that
Definitely.
happen quite a bit?
That does happen sometimes because, again, one of the things that we talked about while we were on break is really fall prevention. Because as the older adult continues to fall, we see more of a decline. And in fact, the Council on Aging reported that 46% of older adults who fall at home, they don't survive the fall.
Oh,
So that's
really? 46%
almost-
don't survive?
46%, almost half of them,
Don't make
those
it.
falls are fatal. So making sure that we are able to provide the appropriate services, making sure that we are matching them with that caregiver who's actually able to provide the appropriate care is very important, because Now we're talking about a life and death situation.
Yeah.
And those that do make it, we see that there are going to be recurring falls because, yes, they are afraid of falling now. So it creates a whole new fear in their mind that
Murphy's
I'm
Law.
not going to move now.
Right.
Yeah.
I'm going to sit in the wheelchair all day. So our role as care managers is to provide that level of education to the patient, the family, and also the caregiver to provide that reassurance that this is what we are doing moving forward to reduce the likelihood of you falling again.
And then them sitting in the wheelchair gets their hip flexors tighter, and then they're going to fall again because they
And
Right.
can't walk.
And wounds, and then we see like our therapist go in and they have to do not only a fall injury prevention, they've got to go in and do like a gait and muscle strengthening training. They have to go in and really get them to come out of their chair and get up and doing the exercises to get them stronger.
Now, most of the time I thought, like with the falls that seniors had, it was they broke their hips. But to be fatal, does that mean they're having a lot of head injuries?
They do have a lot of head injuries because brain injury is very common, and sometimes they may not die from it, but cognitively it changes everything.
Yeah.
And, you know, I recently had a patient who was fine before, and she had a fall, and she had to have a craniotomy because there was hemorrhage in her brain. And now we are seeing this patient does not know what's going on.
Yeah.
And again, we try to be proactive versus being reactive, because sometimes when we try to react to situations, it's a
Yeah.
little bit too late.
So do you guys have, your therapists are going out with the fall prevention and they're working, like you said, on the strengthening and the stretching? So they're really using the time wisely.
Yep, even on joint replacement. So when those hips are, when they have fallen and it is a broken hip, we also do joint replacement training and trying to get them strengthened, get their strength back up. So
Yeah.
that,
So if you see if you see a client who's doing the little old lady, I call it the little old lady walk, where she's looking down and she's barely moving, is that when you talk to the physician, you prescribe physical therapy? Is that?
absolutely, that's a perfect patient because you want to make sure that you're keeping them safe. You're teaching them to make sure they're picking up their feet or not scooting. Or there's so many different.
Or the
stuff.
kyphosis, where they have the humps,
The hump, yes.
from
And also, like,
bad
we'll be in
posture.
a doctor's office many a days, the reps that are out on the road, and we're in doctor's offices and different specialists, and we see patients who it can take you almost want to help them get up off the chair because it's taking them a long time to lift themselves, and they're they're shaking and they're stumbling. So those are also times where they can fall, slip, slide.
Yeah.
There's a lot of different things, scenarios and things that we look for as well to make sure that we're getting them the right services for them.
I think the worst, though, is the walkers, where it keeps them in that poor posture. I saw a commercial, and I forgot what it's called, where they actually had it right. They keep you in an upright positioning. You probably know what it's called, but yeah, I forgot it. So it's like actually helps them where they don't have to stare at their feet and they can keep their, good posture.
And many
know?
times, one thing that people don't know is that those walkers, they are adjustable.
They can raise them up.
So raising them up and making sure you're teaching that elderly person the proper techniques, it goes a long way, because they are bending down because their equipment is not adjusted. So this is something that's big for us too, that we make sure that, yes, you have the equipment, but are you using it to, what it's meant for? Are you really making sure that you are using it to your benefit? Because we don't want to give you something that makes you get worse.
Right.
Yeah.
And I'm sure you've seen that happen.
Yes.
So you kind of come in there and then teach how you adjust it for them, which is great.
Yes.
Yeah. How much did that improve their posture?
We have to remember that for new patients that we just meet, they've been doing this maybe 15 years. So it's going to be a lot of re-education and making sure we emphasize this is what needs to happen. And when the therapists go out to the home, and myself,
physical therapist?
Exactly, myself as the care manager who's in the home, there's a caregiver in there. I make sure that they follow the therapy session to make sure that they are able to help that patient in carrying out what the home exercises are. So this is something that is big for us too, where we make sure that the older adult, even though there isn't a physical therapist in the home at that particular time, but they do give them home exercise program where we make sure that they continue to do those, because we all know practice makes perfect. But when we've been doing something for 20 years, it's hard to adjust to that. But, with time, we see that it actually happens.
So is the patient doing those exercises on their own, you said?
The therapists, they do give home
Sometimes, yeah,
exercises.
sometimes the therapist is obviously there doing the exercise with them, but they get like little homework sheets. And
Yeah.
they're told how to appropriately get up, how to do certain movements, and how to continue getting stronger that they can do on the days that they're not there. Or, if they get a little burst of energy, they can do those exercises. So a lot of times we leave them little sheets and they have those, extra
Yeah.
little things that can help them get stronger.
Yeah. What about how often do you see folks recover nicely from those falls where they've broken a hip? When you guys get involved?
Yeah, I definitely see a great, we have surgeons now that are doing it orthoscopically, and these patients are doing amazing. I mean, I've seen some patients that are back on the golf course within 10 weeks, sometimes
Wow.
even 6 weeks. 6
Yeah.
weeks. I mean, they're standing.
Men in their 80s? And
Yeah,
women
I
in their
mean,
80s?
Well, they have
Wow.
all different ages. I mean,
Right.
hips are, sometimes I've seen them as young as in the 50s going out and getting a hip surgery. So.
Oh my gosh.
And it's important to notice also that the post-discharge care is really important in making sure that these patients are able to return to their prior level of functioning, because the surgeon may do an amazing job, but then from them leaving the office, we have to make sure they continue on, because it's not something that happens one time and you fix. So we have to continue to provide the appropriate care at home to make sure that they are going to their follow-up appointments and they are following the doctor's orders in order for them to return to their prior level of functioning.
Yeah.
Yeah, and I would definitely say the post-surgical care is very important. A lot of the patients who are getting the hips or the knee replacements, we can go in, we have the nurse checking the sutures, not only, once the doctor gives them the okay to start doing the exercises and the therapy, we immediately get in there and do that as well.
Which helps
Yes.
a lot.
Yep.
I mean, service at home, you can't beat that, right? You don't have to go to a hospital or a place where there's diseases and infections. You're at home. It's nice.
And the traffic, you avoid the traffic and you
Yes.
avoid all. So home care has its benefits for sure.
They say if you want to get sick, go to the hospital, right? So we talked earlier about, Ketsia, individuals who have long-term care and that, got a policy and they've got a way to pay. What are the options for people who can't afford and need help?
It really is based on a case-by-case basis. Depending on what's going on with that family, I could make recommendation for care. Depending on their financial stability, we can definitely talk about other community resources that they could be eligible or qualify for. So by all means, our care managers do take all of that into consideration in making sure that we are able to assist the patient in accessing community resources.
And if you are fortunate enough to have bought a policy when you were younger and get great benefits, how do you maximize the amount of long-term care money that you have versus running out and then going, oh, I'm going to live another 20 years, but I don't have enough money?
Right. I mean, typically it depends on what that policy covers and, the duration of it, because we've had patients that had long-term care, they were in the hospital, they've used it, and then 5 years later something else happens, they're using it again, but in 5 years they are getting less for their services. So sometimes it's really good to look at, the resources that they have and whether or not there are any other resources in the community that they could benefit from long-term. So
You mean to
these
use
are-
in conjunction with their policy so they're not draining it?
Yeah, so we can look at different possibilities depending on what exactly that policy covers.
That's great that you help them look at all options.
Yes, I mean, we definitely provide them with seamless care management services for making sure that we reduce them being back and forth in the hospital. We'll help them in making sure that they are not isolated. We help them in improving overall quality of care by making sure that they have the appropriate services in the home. For instance, for long-distance family members, if something happened to your loved one, you don't necessarily have to request time off from work and purchase a plane ticket at that time.
Oh.
We can always go to the hospital. We are there by the patient's side, making sure that when they are being discharged, all the post-discharge care arrangement are in place. We make sure that they go to the appropriate level of care to make sure that they can actually have the most services that's going to get them back to their prior level of functioning. And of course, we do communicate with family members. We keep them in the loop as far as what's going on with their loved one. I use a great software where I can easily send access to the family members, and they are able to go in there and see everything that's going on, when the next appointment is due, what medications they are on, when they are going to the doctor's office. So basically, even calling me, if they don't need to, they just want to, they get home at 10 o'clock, they want to go and look in the chart, they already have access to that, so they are able to see everything that's going on with the patient.
That's great. And, we talked offline about this. You were talking about how, it's a family in New York, their elderly parents are down here, and, they have to work, of course, and maintain their family, and they can't come down here every time mom or dad's in the hospital or there's a situation. You're kind of like that family member that lives in the neighborhood and stops by.
Exactly. And also there are local families that, their children, they work, they have kids on their own, and they are dealing with life as we all are. So, and of course, the healthcare system is so complex that it's very hard for people to understand where to go. So that guidance that we are able to provide as healthcare professionals, we are able to actually quickly get that person back to their prior level of functioning or something close to that, as it permits.
Yeah. So, Jackie, remind folks, just give us an overview again of what, both Elite Home Services does. I know you said some psychiatric nursing. And
Oh, absolutely.
other
So
things.
we do everything from skilled nursing to physical therapy, occupational therapy.
And skilled nursing, why don't you define that?
Basically, we can do diabetes teaching, any type of vital signs. We go out and check with the patient. We're constantly doing PTI&R monitoring. We can do wound care monitoring for their wounds, and also wound care. We do Foley catheter care. We do IVs on certain occasions. Like if a patient is in need of an IV, and the hospital is able to discharge them home safely, we go out and administer the IVs for them. And we do basic, if they have a new diagnosis, we go out and try to help them with their new condition. As I
Speech
said-
therapy.
Oh, absolutely. We do speech therapy.
People have
psychic-
strokes, unfortunately.
And
but-
that's something that we do a lot of, actually. We do a lot of the speech therapy. So,
Yeah.
and we have, like I said, the therapy portion of our program, and we have social workers, and then we work in contact with geriatric care management companies like Kitsia's.
It's great when you network and you have the right people.
We do.
Give folks your phone number again and where
I'm going
you're-
to give you the 800
Yeah.
number. It's the 1-888-422-3578. It's Broward, Palm Beach, and Martin, St. Lucie.
And Ketsia, one more time, give folks your contact info.
954-446-7022. We do offer a complimentary 30-minute phone consultation. So if you have any questions, be proactive. Do not be reactive to situations. We are able to provide you with practical solutions to all of your care management needs. So give us a call, and we'll be more than happy to assess your loved one and provide some solutions.
And that's how I'm going to end the show, with those famous words of Ketsia. Be proactive, not reactive. Get the right care for your loved ones.
Thank you for listening to the Elite Home Healthcare Show. Elite Home Healthcare delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the costs with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individualized plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care, along with your participation and your doctor's guidance, assuring a plan specific to your needs. We'll make multiple visits to your home over weeks or months to make sure you are recovering according to plan. For more information, call us 888-422-3578. Join us for more information and news on our next show.
Diamond Princess Cruise Ship, Vice President